I'm Baruch Krauss. I'm a pediatric emergency physician at Boston Children's Hospital and an Associate Professor of Pediatrics at Harvard Medical School. My area of interest and research is helping children manage their fear and pain associated with medical encounters, whether they be for a procedure or simply for a physical examination or coming into the hospital, which can be quite stressful for families and for children. I've spent many years working on medications to help calm children, and what had eventually occurred to me was that what was fundamental in producing a positive experience for a child and their family in a medical encounter was to establish trust. However, although establishing trust is a foundational skill in pediatrics for anyone who works with children and essential for the doctor-patient relationship, there's no systematic approach and no formal training in medical school for learning this skill set. So I have developed a methodology or an approach for rapidly establishing trusting relationships with children. It's based on perceiving, accurately interpreting, and appropriately responding to the verbal and nonverbal cues of the child in such a way that you effectively manage their emotional state and form a human connection with them. In the process, the experience is positive for the child, positive and not stressful for the family as they see the effect on the child, and it's actually humanizing and rejuvenating for the practitioner, because this is why we went into medicine, to be able to form a human connection, to really make a difference in the life of our patients. So this approach is really grounded in clinical observation. It actually has three sequential steps: observe, engage, monitor. So you're using clinical observation to gather data to assess the emotional state of the patient, and here you're looking at facial expression, eye behavior, posture, gesture, voice, touch, in order to determine how fearful the child is, what their emotional state is, and how you could respond to that in order to calm and comfort them. Once you have assessed effectively and accurately their emotional state, then you apply a set of engagement methods in order to move them from fear to trust. And there's a whole toolbox of these. Many clinicians have this toolbox and do these methods intuitively. My contribution is to give a vocabulary and a framework to what they are doing that makes it more accessible to them so that they can actually teach it more effectively. So there's observe, engage, and then monitor. And all the time, it's a very iterative process. You're watching the feedback of your response to the child, and based on their response to you, you're adjusting your next approach. So it's a very iterative process. It's not formulaic. So it's not like you have a 2-year-old, and the last 2-year-old you blew some bubbles for, and that got the 2-year-old very engaged. Well, if you did it with the next 2-year-old blowing bubbles, maybe they might respond, maybe they wouldn't. And maybe all these 2-year-olds, 50% would, 50% wouldn't. It's because you're not responding to an individual, you're just formulaically doing it. So it's really an iterative approach. It's an individual responding to an individual in order to effectively manage this child's emotional state to move them from fear to trust. Once they, and for children, this is a very pragmatic goal because children will not cooperate with a physical examination or a minor procedure unless they trust you. So it becomes very important to be able to establish trust with them. I think for older children and adults who will, although they may be fearful, will cooperate, this approach allows them to have a respite from their stress and fear and anxiety in a medical setting, and produces a positive experience for them that can be pleasurable and engaging. In my course with the medical students, I have a picture of a bulldog. The bulldog's name is Jordan. And I said, all of you know how, intuitively, to approach a dog. You would respect their distance initially. You would speak in a particular vocal cadence, usually high-pitched and lilting. Nice doggy, good doggy. And you would watch the dog's cues. How many teeth are showing? Are the ears up or down? Is the fur up? Is the tail wagging or not? And then you would begin to interact with the dog, and you would watch to see how they responded. And you'd see as the ears went down and the tail began to wag and the fur went down, you would move closer, closer, you continue to talk to the dog, and eventually you would read the cues in such a way that you know you moved that dog to a state where they trust you, and then you would be able to apply touch. Well, the same principles apply to interacting with children. And I've just here kind of deconstructed this process that I teach the medical students about how to read the cues of children and respond appropriately. Now, this is applicable not only in a medical setting, but, for example, in a classroom. You really need to be able to observe and read the cues of not only the individual child, but the entire group in order to know how to effectively respond to them, to be able to teach them and have them open to learning. Again, this is the same thing. This is, I see you. I notice you. I notice you as an individual. It's very powerful. I do the same thing with children. If I walk in to see a 2-year-old, there's a technique I use called arousing curiosity. It's how you get a young child curious and interested in you. You do it by demonstrating to them that you notice them as an individual. And what does that mean for a 2-year-old? I may walk in the room and say, you have beautiful green Crocs on, and blue pants, and a white shirt, and one nose, and 2 ears, and 2 eyes. So what did I just say there? I just said, I see you. I notice you as an individual. It's very powerful in terms of making a connection. And what it does immediately is, as you said, in the classroom, it focuses their attention on you. They give you their attention, and they begin to trust you. And they're quite curious as to what you're doing, but they notice that you notice them as an individual. It's no different than if you saw a friend who had a new pair of glasses which had a blue tint on them, and you said, oh, I noticed really nice glasses. I really like the blue tint. You know what that makes you feel like. You're noticed. They noticed you as an individual. They saw something. You have to train yourself. It's a commitment to be able to observe in your environment and to grant importance to observing certain features of people you're interacting with. So you notice them as individuals. As again, noticing is the beginning of empathy. So it's a way of really connecting with people effectively. And it's very powerful in children. And it can be done non-verbally or verbally. So I have no trouble in engaging a 6-month-old. And often people ask, well, there are very specific ways of being empathic with an adult. There's a certain techniques that you do. You sit forward, you nod a certain way, you repeat what they have to say. But how do you express empathy to a 6-month-old? Well, it's all about noticing and responding to them as an individual.